Hi, I am Dr. Professor Alex Rema Zacariah, MD. I was the former Chief Medical Officer of Provina United Samaritan Medical Center in Danville. Now I'm retired and settled in Urbana. And we have starting a series of health and wellness related topics that is very important to every one of us. And this is our first episode, and we are starting with that very recent news of viral meningitis. For this, I have today with me a very distinguished person, and Krishna Tangella, MD, Christie Clinic pathologist. He's board certified in both anatomic pathology and clinical pathology. Dr. Tangella interprets and diagnoses changes caused by disease in tissues such as fungal meningitis. Dr. Tangella is a member of board directors of Christie Clinic and Provina Covenant Medical Center, Provina Covenant Medical Center Foundation, Champaign County Medical Society, and he actively participates in collaborative translational research at the world-renowned Beckman Institute at the University of Illinois at Urbana-Champaign. Dr. Tangella is the president of the Champaign County Medical Society, and he is in the board of directors of Illinois Society of Pathologists, fellow of the College of American Pathologists, fellow of the American Society of Clinical Pathologists, and American College of Healthcare Executives. So therefore, we have the best person to tell us about this very important matter of viral meningitis. Can you provide a brief background of the recent fungal meningitis outbreak?
Sure. Thank you, Dr. Zacariah, for the kind introduction. As you probably know, that this is an active investigation that's happening right now, where the details are coming in and the case is being investigated thoroughly by the CDC and also by the FDA. As you recall from the news items that are hitting the newspapers and the news media, that there is an outbreak of a series of fungal meningitis that has occurred in multiple states across the country. And this has resulted in numerous infections. Some of the infections have resulted in death. And one of the things that has come out clearly is that this infection is caused due to a contaminated medication from a New England compounding facility in Framingham, Massachusetts.
Let me ask you, is this the first episode ever of contaminated injections, or it had happened before?
Yes. So this is not the first instance where a compounding facility has resulted in infected medications resulting in infections in patients. This has been reported before. What is more concerning in this case is the magnitude of the number of patients that are involved and the number of deaths that has resulted from these infections.
Let me ask you, are these patients or well-to-do, healthy, active, exercise-oriented population?
So you ask a very good question. Generally, fungal meningitis are extremely rare.
Yes.
When you talk about meningitis, you either talk about a bacterial meningitis or a viral meningitis. That's something that is commonly encountered in medical practice. In this situation, fungal meningitis is rare.
Yes.
Fungal infections in general occurs in individuals who have a decreased immune system. Those patients who have prolonged steroidal therapy, patients who have malignancy, cancers, who are getting treatment for cancers, patients who have undergone bone marrow transplant, patients who have undergone immunosuppressive therapy due to autoimmune disorders.
So those whose immunity is compromised.
Those are the individuals who usually get fungal infection. But in this situation, as you mentioned, this would this infection occurs in healthy individuals also.
Yes. So therefore, okay, what's the significance of fungal meningitis?
So the significance of fungal meningitis is that it is rare.
Yes.
A treating physician will not be aware of an incidence of fungal meningitis to occur. If the eyes do not know, eyes do not see what the mind does not know.
Yes.
So sometimes if the fungal meningitis is not in the clinical differential,
Yes.
a doctor may miss it.
Yes.
In this situation, because of the investigation, we are able to heighten the awareness of this entity to the medical community through programs like this,
Yes.
to not only educate the clinical community but also the patients to be aware of signs and symptoms.
Yes.
That should
Is this type of fungal infection contagious?
No. So fungal meningitis is a non-contagious disease, which means that it cannot be transmitted from person to person, unlike a viral and bacterial meningitis, which can be transmitted from person to person.
Like a common cold?
Yes. Whereas a fungal meningitis
Yes.
cannot be transmitted from person to person. So it's important to remember those individuals who are taking care of these patients,
Yes.
they will not get fungal meningitis from the patients.
How many cases have been reported?
So they have been, it's a nationwide problem.
Yes.
What we know right now is about 14,000 potentially infected patients.
Yes.
14,000. Yes. Potentially infected, patients. Not all the patients who have got the infection may get the infection.
Yes.
But this is the at-risk population.
Yes.
Of which we are medical community with the
Yes.
help of CDC and FDA is reaching out to those patients.
Yes.
As we are discussing today,
Yes.
we have reached out to approximately 12,000 of them to make them aware of a potential risk.
Yes, like this program that we are having.
Yes.
That we are trying to reach out.
Of the 14,000
Yes.
potential at risk,
Yes.
there are approximately 225 or 235 confirmed cases of infection due to
Yes.
contaminated product
Yes.
in about 15 states
Yes.
and resulting in 15 deaths.
How many cases have been reported in Illinois?
So we have been, this is a sad situation.
Yes.
Okay. And Illinois has been on the better side of the statistics.
Yes.
In the sense that only one patient has been confirmed
Yes.
infected due to the contaminated product. And there have not been any deaths
Yes.
in Illinois from the fungal infection as of today.
Yes. Any in this Champaign County area?
So New England Compounding
Yes.
Center
Yes.
has a list of lots that have been contaminated, potentially contaminated, and they know which geographical regions of the country these infected or contaminated medication have gone out to.
Yes.
There are only 3 healthcare facilities in Illinois,
Yes.
in the Chicagoland area,
Yes.
that have got this contaminated medication.
Yes.
No healthcare facility in the Champaign County
Yes.
have received this contaminated product from New England Compounding Center.
That's good news.
That's a good news for
Good
Champaign
news.
County.
Yes, and is this New England compounding centers still producing injectable products?
No, they have actually issued a recall on all the products that they have shipped out. They have stopped manufacturing and stopped compounding medication. They have voluntarily at this point suspended their operation, and they have given back their license to compound to the government.
Yes. Today's newspaper, there was an item that the government is planning to start proceedings on criminal grounds. Is that something that government might do?
Well, given the extent of the medical problems, given the extent of deaths here, certainly it's the government to decide if there is any criminal
Yes.
malfeasance in this situation,
Yes.
and they will take appropriate action as necessary.
How should the healthcare providers do to protect their patients from the threat of potential meningitis?
So the providers have this obligation to make sure that they did not receive this contaminated product from
Yes.
the compounding facility. If they did, they have to return it,
Mm-hmm.
or because it's been recalled, and also if they have injected this contaminated product to the patients in terms of injecting into epidural space,
Yes.
injecting the contaminated product into knee joints,
Yes.
injecting contaminated product into eye during eye surgeries or heart surgeries, they have the obligations to reach out to at-risk patients and inform them of the signs and symptoms of the infection, and so the patients are aware of the risk that they are, and early diagnosis and intervention can be performed on these patients.
Would you have anything to suggest that anyone who received a steroid injection on any account be on the cautious side and to get to their physician to see whether it is this product?
So in my opinion, that's an overkill, because
Yes.
the steroidal injections occur thousands and thousands of times in any community,
Yes.
over a period of a month.
Yes.
So it is important to kind of target the patients that have received a contaminated product.
Yes.
It is important to be aware and
Yes.
over-cautious about who got it.
Yes.
But it doesn't have to be for every steroid injection that patients have got.
Now, is there the procedure set into motion that everyone who has received this product from this particular drug company would be contacted?
Yes, the FDA and the CDC have a recommended procedure,
Yes.
Which can be found on fda.gov and cdc.gov, to reach out to these individuals who have been injected.
Okay. What is meningitis briefly?
Meningitis, put in layman's term, is the inflammation and infection of the membranes that surround the brain.
Okay.
The meninges is an organ, or rather the membranes that surround the brain. Inflammation
Yes.
of that membranes is called meningitis.
Who get this meningitis?
So it depends on the cause. The bacterial meningitis and viral meningitis have obviously, they are not uncommon, and at-risk population are the babies or elderly who would get this kind of infections. But this particular fungal meningitis would occur in individuals who have got an epidural injection
Yes.
by a steroid called methylprednisone,
Yes.
due to most commonly for backaches.
Yes. As a physician, let me ask you, is this fungus been isolated and cultured?
So there are two fungi
Yes.
that have been implicated in this outbreak.
Yes.
One is called Aspergillus
Yes,
species, and the other is called Xerohilum.
Yes.
Aspergillus is commonly found in soil.
Yes.
It is found in building materials.
Yes.
It is found in humid environments,
Yes.
and this is a common fungus.
Yes.
And when it causes infection in immunocompromised
Yes.
hosts,
Yes.
and usually results in a fungal infection
Yes.
of the lungs.
Yes.
Xerohilum
Yes.
is an even rarer type of fungus
Yes.
that is found in moist soil,
Yes.
that causes infection on leaves
Yes.
and the grass.
Yes.
Very rarely in immunocompromised individuals,
Yes.
it can cause infection of your sinuses, called
Yes.
sinusitis, or infection of your skin.
Yes.
In these situations, there is an infection of the meninges
Yes.
that is caused by this fungus,
Right.
which is very uncommon.
All right. Now, as we mentioned earlier, this fungal infection is seen only mostly as a medical oncologist in a very severely compromised or immune system compromised person. Now, as you said, these fungus are not very aggressive funguses. They are commensals in a lot of environment. Now, these has been injected, this fungus, can they remain dormant in wherever it's been infected, like joints or elsewhere, and show up later?
Yes. So you said that these are not they are not very serious
Right.
infections. The answer to that, I would disagree. These are serious infections.
That's right, in the places which should not be there.
Yes, that's absolutely correct.
Yes.
Especially if you inject this fungus into your spinal cord
Oh,
and
yes.
it goes into your cerebrospinal fluid that
Yes.
is directly connected to your brain,
Yes.
this is not going
It
to be
is very
happy.
serious.
Yeah, in fact, it causes very severe meningitis and can result in death.
Yes.
So one has to be very, very aware of this infection.
So that brings us to the next question. What are the signs and symptoms we need to look for?
Sure. The signs and symptoms of a meningitis
Yes.
includes fever,
Yes.
severe headaches, photophobia,
Yes.
which means like an aversion to bright light, as I said, stiff neck,
Yes.
yeah, sometimes fever with chills,
Yes.
backaches, so nausea,
Yes.
vomiting.
Yes.
So these are the symptoms of a meningitis
Yes.
one should be aware of.
So anyone who had an injection, steroid injection recently, have any of this, they need to seek medical
Yes.
advice.
So somebody who has got an injection with a contaminated product
Yes.
usually would get one of these symptoms.
Yes.
It depends where the injection occurred.
Yes.
If the injection occurred in an epidural space,
Yes.
which is connected to your spinal cord,
Right.
it will cause meningitis.
Yes.
And if the injection occurred on a joint fluid,
Joints.
then you will have infection of the joint.
John.
As we are talking right now, there
Yes.
has been an update
Yes.
that there could be other type of drugs that
Yes.
could be infected.
Yes.
And we have found one infection in a transplant patient undergoing heart surgery. So, that's also an instance in which you can have an infection.
Yes.
Generally, when you get injected with an infected product,
Yes.
you would get signs and symptoms within a week.
Yes.
Sometimes it may take up to 3 weeks.
3 weeks.
In majority of cases.
Yes.
But there has been instances where the signs and symptoms have not started 42 days
Oh.
after the injection.
Yes.
So we don't know how long
Yes.
is the incubation period.
Yeah.
One has to be very careful,
Careful.
for a prolonged period of time.
Is fungal meningitis serious?
Yes, it's a very serious illness, and it can cause severe mortality and morbidity to
Yes.
the individuals who are affected.
All right. We already talked about the type of funguses, and
Right.
and this type of fungal infection is really rare, right?
It's very, very rare. I have not heard of a meningitis due to Xerohilum
Yes.
rostratum, which is the fungus that causes this kind of meningitis in my lifetime. I mean,
Yes.
this is the first time I'm
Yes.
hearing about it.
Is there a place for prophylaxis in asymptomatic persons who received this injection?
Very good. So the answer is no.
No.
One has to be very aware of potential signs and symptoms in these patients, but one should not treat a
Yes.
patient who has been
Yes.
potentially been injected with infected or rather contaminated medication. At this point, the CDC does not recommend a prophylactic therapy in these patients.
And yes, you covered it to some extent. The symptoms may be from within a week up to
42 days.
42 days. 42 days.
Sometimes it can be longer than that. We don't know, so we have to be extremely careful
Yes.
for prolonged periods of time.
Yes, and how do we keep ourselves updated and on this particular subject?
So the FDA and CDC
Yes.
has fantastic information that
Good.
they update almost on a daily basis on their website.
Yes.
You can reach out to fda.gov
Yes.
or cdc.gov. That has information not only for the clinicians, but also has information for the general public,
Yes.
including the patients.
Yeah, this is a very naive question, but still I need to ask. Patients who did not receive this injection, are they at risk?
No, the patients who did not get this medication are not at risk of getting fungal meningitis. And if they are caregivers of somebody who is diagnosed with fungal meningitis, are not at risk of getting the infection from person to person transmission.
And any of those who think they have received this injection, if they believe so, what do they do?
Well, if you believe that you have been injected with a contaminated product for a knee joint, for your back pain, or have undergone an eye surgery or a heart surgery, and you believe that probably or potentially there could have been a contaminated product used on you, you will have to reach out with your healthcare provider who did the procedure and ask them, am I at increased risk? And they should be able to tell you whether you are or not.
I brought this point again some time ago. Very fit and active people who are at the best of their fitness, for some injuries, are there possibility there are some instances in which they were the best in health, and for some ligament injuries or knee injuries, this injection has been given?
Sure. The reason why one would give a steroid, injection of steroid, would be for a backache or for your joint ache.
Yes.
And in this episode of outbreaks, one has been able to diagnose meningitis.
Yes.
One has not been able to diagnose infection of your joints yet.
Yes.
So the answer to your question is yes.
Yes.
Even somebody who's extremely healthy has a pain in a joint or pain in your back, receiving a contaminated product, can get infection through contaminated medicine.
Yes, in the short time we did have a comprehensive coverage of the most important points, and Dr. Tangella, you did a splendid job, and I thank you.
Thank you very much.
And for this opportunity to bring to you what is the latest on this viral or this fungal meningitis that has been reported.
Thank you very much. Thank you for having me here.